the spinal exercises make use of the basic principle that changing the position of the body changes the direction of the muscle pull and moves the points of support. Correct initial position is essential for subsequent movement. By not respecting this principle, we cannot achieve lasting changes in posture. Every exercise starts from a very important initial position, followed by very well-defined movement. This initial position is maintained throughout the whole range of movement and is an essential part of it. Phase 1. Getting ready. First, the patient has to be made aware of the contact points of his body with the floor he is lying on. We ask the patient to push his head down on the floor in a dorsocranial direction. This simple maneuver results in new points of support. The whole body posture changes as a result of changed muscle pull. The patient must be conscious of these changes. Then the pelvis is pushed down on the floor in a dorsocaudal direction, and again the patient must feel this change in posture caused by the different muscular pull. Breathing is very important. The patient must feel his diaphragm working against the abdominal cavity. We ask the patient to place his fingers dorsolaterally under the lower ribs. He should feel his fingers being pushed outwards by the activity of the diaphragm and hold it throughout the exercise. Phase 2. Exercise in a supine position. Torsion of the spine is performed in a supine position. The arms are stretched to the side. The head turns to the right while the pelvis to the left, and then vice versa. The upper edge of the shoulder blades do not move but remain in contact with the pad. The movement of the head and pelvis must be synchronous. The movement is repeated for as long as the patient can comfortably breathe. If the patient is short of breath, he interrupts the movement, takes a deep breath, then returns to his initial position and repeats the exercise. Phase 3. Relaxation. After 4 to 6 repetitions, relaxation takes place. The patient inhales, slightly stretching the thoracic spine, and bends his arms and legs. While breathing out, the body drops on the floor with the head turning to the side. This relaxation phase comes between each exercise. Modification A. Exercise in a supine position with the legs semi-flexed and knees touching. Changing the position of the legs results in different points of support. Due to changed body position, different afferent stimuli are transferred to the central nervous system, resulting in changed muscular activity. This modification of the initial position also influences the range of torsion movement in the individual segments of the spine. This can be of use in therapy. Phase 1. Getting ready. The patient lies in the initial supine position with the arms stretched out. The legs are in a semi-flexed position close to each other. Again, the patient should be aware of his points of support while simultaneously pushing the head in a dorsocranial direction and the pelvis in a dorsocaudal direction. In this case, the contact of the thoracolumbar junction with the floor is very important. The patient is asked to press his TL junction down on the floor. The patient must check his breathing. Phase 2. The exercise. During torsion movement of the spine, the same principle as in previous exercise is applied. The head turns to the opposite direction from the pelvis. The shoulder blades remain on the floor. This gives muscle pull favoring the TL junction. Phase 3. Relaxation. After a few repetitions, relaxation follows. The relaxation procedure is the same as in the previous exercise. Then the patient changes the position of his legs again, and another modification of the spinal exercise in a supine position is performed. Phase 1. Getting ready. The initial position is supine. The patient's legs are fully flexed, knees pulled up towards the chest. The head and TL junction are actively pressed down on the floor. The diaphragm works against the abdominal cavity. This position elongates the lumbar spine and lifts the pelvis above the floor. However, the area covered by the trapezius muscle remains on the floor. Phase 2. The exercise. This exercise differs from the previous modification in that the pelvis is lifted. The center of gravity is kept in the area of the upper thoracic spine throughout the whole procedure. Increased tension at the TL junction and in the abdominal cavity helps to lengthen the lumbar spine and to lift the pelvis. The maximum torsion movement takes place at the level of the T4 segment. Phase 3. The relaxation. After a few repetitions, the patient relaxes again as in previous procedures. Spinal exercise with the patient lying on his side. Phase 1. Getting ready. The patient lies on his side with the lower arm flexed at the elbow, the head cradled in the palm of this hand, and the legs semi-flexed. We instruct the patient to move his head further in the cranial direction and support himself on the elbow of the lower arm. In this way, the abductors and depressors of the shoulder blade are activated. The direction of pull of all the activated muscles is from the spine towards the arm. The cervical and upper thoracic spine lengthen. At the same time, the outward rotators of the hip joint are activated as the patient supports himself on the knees and on the side of the thigh of the lower leg. As a consequence, the lumbar spine lengthens. Here again, correct breathing is essential. Activity of the diaphragm, especially of its lumbar part, increases intra-abdominal pressure. The chest is in the expiratory position, and abdominal, deep back muscles, and the pelvic floor are activated. To make sure that the posterior part of the diaphragm contracts, we place our finger on the dorsolateral part of the abdominal wall below the lower ribs. Our finger should be pushed outwards as this part of the abdominal wall and the diaphragm are activated. If done correctly, this procedure decreases spinal curvature in the sagittal plane and the whole spine lengthens. All parts of this phase must be done simultaneously. Self-applied traction of the spine as achieved during this procedure is an important part of the exercise. Phase 2. The exercise. The pelvis is rotated forward and back to the initial position. The head does not move but remains cradled in the palm of the lower hand. The upper arm is semi-flexed at the elbow, placed in front of the body with the palm on the floor. This arm is passive, neither helping to support the body nor to rotate the body. Phase 3. Relaxation. After a few repetitions, the patient actively relaxes. He extends and lifts his knees during inhalation and slightly flexes and lets them drop on the floor during exhalation. The Sphinx. This exercise mobilizes the T4 segment of the spine into extension. Phase 1. Getting ready. The patient is prone and the forearms and palms of his hands are placed on the floor with the fingers at the level of his nose. He supports himself on his elbows, thus activating the abductors and depressors of the shoulder blades, resulting in traction of the T-spine and activation of the deep back muscles. The direction of pull of all the activated muscles is from the spine towards the arms. The other point of support is at the symphysis, which activates the outward rotators of the hips. To make sure that the patient breathes correctly, we place our fingers on the dorsolateral parts of the abdominal wall below the last ribs. The movement of the diaphragm should push them outwards. During this phase, the chest is in the expiratory position and all abdominal muscles, as well as the deep back muscles and the pelvic floor, are activated. All these movements should be made simultaneously, resulting in muscular coordination on the ventral and dorsal aspect of the trunk. This stabilizes the spine in the sagittal plane. Phase 2. The exercise. Maintaining correct initial position, the patient is instructed to push actively on the points of support, i.e., the elbows, and the symphysis, which again elongates the whole spine and especially extends the T4 segment. Extension of the T4 segment is possible only if there is traction at the same time. Resting on the elbows and the symphysis without traction would not be sufficient for T4 mobilization. The Cobra exercise. Phase 1 is the same as in the previous exercise. The initial position is that of the Sphinx. The patient then slowly shifts the points of support, straightening his arms until he is supported by his wrists. As the body is lifted, the position of the cobra is achieved. The head is stretched forward in line with the T-spine. We ask the patient to maintain this position as long as is comfortable, and then to go back to the initial position. The procedure can be repeated several times.